Thank you for joining us for this interactive Facebook Live event presented by Siteman Cancer Center based at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. Siteman is an international leader in cancer treatment, research, prevention, and education. Ranked among the top cancer centers by U.S. News and World Report, Siteman also is one of only a few U.S. cancer centers to receive the highest rating of exceptional from the National Cancer Institute. Welcome to today's Facebook Live.
Thank you for joining us for this Facebook Live event sponsored by Siteman Cancer Center, which is based at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. Today's topic is colorectal cancer, including screenings and other prevention measures, as well as advances in patient care and some notes on the alarming rise in rates of incidence with young adults with colorectal cancer. Joining us today are two Washington University physicians who treat patients at Siteman Cancer. To my immediate right, we have Dr. Hyun Kim. He is a radiation oncologist and chief of gastrointestinal service and an assistant professor of radiation oncology. And we also have with us Dr. Matthew Silviera, a colorectal surgeon and assistant professor of surgery. Welcome, gentlemen, and thank you for being here.
Thanks, Jim. Thank you.
To our folks out there, we remind you that during this live event, we invite you to ask any questions you might have of our experts in the comment section for them to answer later. And we're going to go ahead and start first with you, Dr. Kim. To start, would you tell us how common colorectal cancer is and what men and women should know about it?
Sure. So colorectal cancer is very common. It's the third most common malignancy in the U.S. and also third highest mortality malignancy. We estimate probably 150,000 cases in 2021, a third of which will be rectal cancer. And what we know, so it's a tumor of the colon or the rectum, sometimes right in the transition point. And when we speak of colorectal cancer, we most commonly refer to adenocarcinoma. But there's different histologies, fancy terms like sarcoma or lymphoma or gastrointestinal stromal tumor. But really, when people talk about colorectal cancer, it's really this adenocarcinoma that we're talking about.
And of course, the best way to treat cancer is to prevent it in the first place. What are some prevention strategies, some measures that people can do to hopefully stave off that diagnosis?
Sure. So there's no one way to reduce the risk completely. People can eat a healthy diet with fruits, vegetables, whole grains. There are evidence that indicate that if you reduce the alcohol consumption, eliminate tobacco, maintain a healthy weight and active lifestyle, all of those can reduce your risk. I think kind of the gold buzzword nowadays is prevention, and one of the ways that we can do that is through screening and capturing it when it's still a polyp. So the colorectal cancers start off often as a polyp or a pre-malignant, so not yet cancer type of mass. And if our colleagues in GI or colorectal surgery can find it before it becomes a tumor, they could snip it out and it will never become an issue. Well, hopefully it will never become an issue.
Very good. And obviously, just because you've done all those things doesn't necessarily mean that you're 100% in the clear. And we're sort of seeing that lately with younger adults being diagnosed. An example is actor Chadwick Boseman of Black Panther and other movies, who unfortunately passed away last August at the age of 43. It's a terrible reminder that this can affect people of many ages. And so I'm wondering if you yourself are seeing more patients who are coming in at a younger age dealing with these sorts of issues.
Yeah, we have, and in my practice as well, we have seen increased young onset, so less than 50 years of age. And the statistics show that for the past decade and a half or so, every year that incidence has increased by 2%. And so it's growing. And by 2030, people estimate that the rate of incidence for these young onset people will have increased by 90% for colon cancer and 125% for rectal cancer. So it's a real deal.
It's a real issue, and I'm wondering if we know what the main causes of that are.
That's a great question. So people have done studies, epidemiologists, and they've looked at it. We thought that maybe it would correlate to when societies took on a more sedentary lifestyle, Western diet, but the data don't match up perfectly. And so whereas it may be related to those things, no one's really sure what causes it.
So work will continue on getting to that root cause and hopefully being able to determine a treatment that addresses that?
Yeah, that's a great point. I think that speaks for the necessity of centers that are dedicated to this specific population, that can do the research, that can do the studies, and find out optimal treatment paradigms for these patients. There may be biologic differences, and there certainly are socioeconomic differences as well. And Chadwick Boswick is a perfect example of how even a superhero, right? Someone you would never think he was healthy. He had world-class care, but it's still real, and it can still affect these young people as well.
Well, that's a good reminder, and we'll talk a little bit more about the rising rate amongst young people in a little bit. But first, I wanted to remind our viewers again that if you do have any questions, if anything that our experts say prompt anything, please present those questions in the comment section so that we can address them in a little bit. And now we want to turn to Dr. Silviera and welcome him again, and appreciate you being here, sir. So we wanted, as we mentioned earlier, you're a colorectal surgeon here at Siteman, and screening is very much a central part of this conversation. It's something that not many people want to do, perhaps, or they find reasons not to do it. And I'm wondering what you might say to people who wonder why it's even that big of a deal.
Sure. So, colorectal cancer is probably one of the most preventative types of cancer that there is. And that's the whole purpose of screening colonoscopies. Before you're having any symptoms, you feel normal, you think, why do I need to have this done? But colorectal cancer is sort of a silent killer. A lot of times there aren't any symptoms associated with it until it's too late. So by getting a screening colonoscopy, you're actually decreasing your incidence or how likely you are to have colon cancer, and you're actually decreasing your chance of dying from it. So like Dr. Kim said earlier, we can take out precancerous polyps before they've even become a cancer and thereby decrease the incidence of colon cancer.
In a way, they're sort of working with their doctors to prevent cancer before it starts.
Correct.
And even if you catch it in an earlier stage, it's my understanding that that's the easier stage to begin treatment, to end up with a helpful outcome.
Absolutely. So, in an ideal situation, we're finding polyps before they've become a cancer, and we're removing those and decreasing the incidence of colon cancer. But if we find an early stage cancer, that can be very curable with surgery. If we find cancer of the rectum, so down closer to the anus, that's where it becomes a little bit more complicated, and there's a multidisciplinary approach to that. But yeah, the earlier the stage of the cancer, if heaven forbid you're found to have a cancer, the more likely it is that that can be cured.
Thank you for that. And of course, we all know, I think most of us know what colonoscopies are, but maybe if you could tell us a little bit about what that entails. And then also, in the past few years, a number of other screening tests have been developed and are available as well. Could you tell us a little bit about those too?
Absolutely. So, like you mentioned, colonoscopy is definitely the gold standard for prevention and screening. Basically, you have to drink this very salty solution called a bowel prep that gives you, unfortunately, diarrhea, and it cleans out your GI tract. And then you have some sedation, so you're not awake and you're not aware of what's going on. And the doctor passes a long flexible camera or a long scope and evaluates the lining of the entire colon and rectum. Again, looking for small polyps or early cancers. And like I said, if you can intervene on those polyps before they turn into a cancer, you're potentially decreasing the incidence of having a cancer.
And I would assume, be going through the screening process, whatever that process is that you choose, even if it's colonoscopy, has to certainly be more comfortable than going through the treatment for colorectal cancer anyway.
Absolutely. So I think that, colonoscopy sort of gets a bad rap. Nobody wants to do it. They think it's embarrassing or disgusting or what have you. The reality is that the prep, which is uncomfortable to drink a laxative, has become much more tolerable over time. Patients used to have to drink a gallon of a sort of disgusting fluid, and now they're smaller volumes, easier to tolerate. So here's a personal tidbit. My mom died from colon cancer. I'm 42 years old, and I recently had a colonoscopy, and the prep is actually pretty easy. And I felt a little bit bad, recommending my prep to all my patients, never having done it. And I sort of laughed about it a little bit before I was doing it, wondering, I hope I'm going to do a good job at this, and I'm not going to be ridiculed. But the prep is actually very easy to tolerate, and it was an extremely easy experience. And then you have that peace of mind afterwards, knowing that either a polyp was removed or if something was found, it was identified early rather than late.
Well, and your personal experience there with your family obviously suggests that there are times that you should be speaking to your physician about maybe getting that colonoscopy or other screening tests sooner than the recommended minimum age.
Absolutely. So, for years, the standard has been when you turn 50, that's when sort of the general population should have a screening colonoscopy. As we've mentioned, there's an increased incidence of these young onset patients developing colon and rectal cancer. So patients that are under 50 that normally wouldn't be screened are developing colon cancer and rectal cancer at an increased rate. So the American Cancer Society, as well as the American College of Colon and Rectal Surgeons, has recently changed their recommendations for screening colonoscopies to start at the age of 45. So we're offering screening colonoscopies to everybody who's 45, but there are yet even higher risk subpopulations. So myself, I had a mom that had a cancer. Myself or somebody with a parent should have a colonoscopy at the age of 40 or 10 years before they were diagnosed. Obviously, there's some genetic predispositions and things like that. So there are certainly subpopulations that benefit from even earlier screening, but there is some evidence to suggest that people should be getting screened at the age of even as early as 45 now.
And we're showing those screening recommendations on the screen right now, but of course there are plenty of places to find that information online, and you can always ask your own physician about when the right time is to start your screening.
Absolutely.
You know, of course, screening isn't always possible. People don't always have access, or maybe they aren't of the age like Mr. Bozeman, was. Can you talk about some of the symptoms that people should be aware of just in case?
Absolutely. So, if you experience changes in your bowel habits, so whether it's alternating between constipation or diarrhea or something is different, or you notice blood in your stool or bloating or weight loss, or you're feeling fatigue, things like that should prompt seeing a physician and having some tests done. Obviously, those symptoms don't mean that you have cancer, but those are the first symptoms where you should start to get things investigated.
Very good. That's very helpful information. And Dr. Kim, I kind of wanted to turn to you and talk about some of the resources that are available specifically at Siteman. You and Dr. Silviera obviously work together to come up with the right treatment plan after a patient is diagnosed, coming at it from different angles. You from radiation oncology, Dr. Silviera obviously from the surgery point of view, but there are a number of other members of a patient's cancer treatment team that are available here. And I'm wondering, could you kind of describe how you come up with the right plan for each individual patient?
Absolutely. So we meet weekly and we discuss in our multidisciplinary tumor board. So our tumor board is a meeting of physicians, including clinicians such as radiation oncologists, surgeons, medical oncologists, and then radiologists, pathologists. And so we all put our minds together, review the films, the pathology slides, and then discuss what is the best treatment. And the reason this is so important is that not every patient is the same. In fact, they're all different, and there's different considerations to make. We certainly refer to the National Cancer Center guidelines, and then we also discuss potential clinical trials that are available as well. And so in this group meeting, this tumor board, that's when we put our brains together and figure out what the best treatment is for each individual.
Thank you. And I'm wondering if you could describe to a little bit more detail what a clinical trial is. They're not offered everywhere. I know Siteman has approximately 500 plus for various types of cancer, including for colorectal cancer. But what is it that people should know about clinical trials?
Sure. So a clinical trial is a regulated treatment course that has to be reviewed by people that are not part of the trial, so physicians and patient advocates. And they make sure that the treatment on that trial is safe, but also that it's answering an important clinical question or asking an important clinical question. And so the clinical trial format is to ask questions and hopefully answer these questions that we're not sure about. And so perhaps offering us a treatment that's not standard of care. And so it may be risky, but it may have great benefit. And so we need to make sure so that we're not using humans as experimental guinea pigs, that there's safety measures involved, that there's proper reporting of adverse events, so harm to the patients, and also proper reporting of the good things that happen to the patients as well. And so that's what a clinical trial is. And like you mentioned, Siteman Cancer Center and Washington University, Barnes-Jewish, we have many excellent opportunities, especially even in colorectal cancer.
And of course, it's up to a patient ultimately to decide whether to pursue a clinical trial or not, and that's something that his or her physician would speak to in great detail, I'm sure.
Absolutely. Clinical trials are a great opportunity for patients, and we have patients all the time that are excited about it and all the time that refuse to participate. And if they refuse to participate, we're not offended. We still offer the same great care to them.
It's sort of part of that personalization of care that we make it available to each patient.
Exactly.
It's also how we help come up with new advances in treatment as well, as you know, Dr. Silviera. And I'm wondering if you could sort of speak to us about how the treatment of colorectal cancer has advanced over the past number of years or even decades. You know, you mentioned your own mother. Lots of folks have relatives who maybe went through treatment for colorectal, you know, over the past couple of decades that maybe didn't think the experience was so great. Could you tell us how that sort of advanced over time and what sort of treatments are available now that are new?
Sure. So, you know, the treatment is certain therapeutic regimens available. There's different ways to deliver radiation, and surgery is advancing. There's minimally invasive techniques. There's ways to let people avoid having an ostomy or a stoma bag long term. And specifically, I'll speak to rectal cancer. So, you know, colon and rectal cancer sort of are, you know, lumped together as colorectal cancer. The rectum is about the last 6 inches of your colon. And Dr. Kim and I work together to treat patients with rectal cancer. And rectal cancer can be tricky because it's down closer to the anus. Sometimes people need permanent colostomy bags. And the deal is that avoiding an operation is sometimes beneficial in these patients because of quality of life type of things. And there's some patients that we're actually able to cure of their rectal cancer, and I never even do surgery on them. So Dr. Kim and his team give the radiation, and then one of the medical oncologists give chemotherapy, and a certain percentage of people, the tumor will go completely away, and we have to keep a very close watch on them. But it used to be standard of care to just do a surgery on these people, and there's, you know, long-term consequences of that. We're really pushing the envelope here, and we have clinical trials that we're participating in, looking at, you know, potentially the non-operative management of rectal cancer.
That's exciting news, and I'm wondering what that means based kind of for the outcome of folks. Are people living longer? Are they being cured at higher rates?
Sure. So yeah, I mean, definitely people are being cured at higher rates with the advances in chemotherapeutics and radiation and surgery. We're treating the patient better as a whole and as a group. And I think the important thing, like Dr. Kim mentioned before, is we're really trying to personalize the care for that patient. Some patients want to avoid a surgery at all costs and are willing to go through some other treatment methods to try and avoid that surgery, whereas other patients say, you know, I'm not going to be able to sleep at night wondering and worrying about this. So other patients just want to have the surgery to have it out. So it becomes a complicated conversation, and I think that we do a nice job as a multidisciplinary group here at Siteman to you know, discuss that with the patients and really personalize their care.
It really speaks to all that different experts coming together to develop the right plan for that patient in consultation with that patient.
Absolutely.
Very good. Well, I see we do have a couple of questions here from our viewers, and one from Jen is diet an important part of colorectal cancer prevention? Dr. Kim, would you like to answer that?
Yeah, absolutely. So diet is an important part of reducing the risk, and so as we touched on briefly, diets with fruits and vegetables, whole grains, reducing alcohol intake, those are kind of the key components. I don't think I mentioned this before, but there are some data that recommend taking low-dose aspirin, but that is something that you should discuss with your primary care physician because that may have its own risks as well. But yes, diet is very important, and we should definitely try to eat healthy so that we can reduce the risk.
Very good, thank you. And Dr. Silviera, Kat asks, are colon cancer symptoms just confined to the immediate colon area, or do those symptoms appear outside of that area also tied to that particular cancer?
Sure. So again, a lot of times people develop colon cancers and have absolutely no symptoms. But you can have symptoms from the colon or the rectum itself, like bleeding or changes in your bowel habits. But unfortunately, you can have other symptoms. For instance, my mom's first symptom was having pain in her right upper quadrant. Everybody thought it was probably her gallbladder or something like that. And unfortunately, the tumor had spread to her liver and was causing pain in the liver. So, you know, there's a multitude of different symptoms that you can have because colorectal cancer can often be asymptomatic. That's why it's so important to get a screening colonoscopy.
Again, we're talking about preventing it before it begins.
Exactly.
And we have a question here from Joan who asks, what is the survival rate of colon and rectal cancer patients?
Sure. So It's a little complicated because it depends on what stage it is. So if it's an early stage cancer where it's confined to just the colon or the rectum, that 5-year survival, so your chances of being alive 5 years afterwards, which is kind of the gold standard for surviving a cancer, can be 70 to 95%. So your chances are much better, much greater than not that you're going to be alive and beat this thing. Obviously, if it's spread to other organs, that carries a worse prognosis. But we're really pushing the envelope with our liver surgeons and liver-directed therapy. Dr. Kim will give radiation to the liver, and we've actually been able to cure patients with stage 4 or colorectal cancer that's spread to other organs. So, I can't just give you a number for what is the chance of living, but those numbers are all moving in the right direction, and the earlier you catch it, the better your chances are.
And I think it's important to point out that, we all kind of know what our normal is. We know what we normally feel like, and if something feels wrong or amiss, I guess that's a good opportunity to reach out maybe to a primary care physician. Is that a good place to start?
Yeah, absolutely. That's a great place to start. I mean, you really have to kind of listen to your body, and I think that human beings are great at minimizing things and writing them off as, well, this is probably I strained a muscle or something's going on. But, you kind of have to listen to your body. And when you think that something's changing or something isn't quite right, rather than just bury it and not worry about it, you should bring it up to your primary care doctor.
Very good. That's great advice. I can tell that people are very interested in the preventative aspects of this disease because we have a question here from Melody who's wondering if fiber intake is an important part of cancer prevention. Dr. Silviera?
It is. So as Dr. Kim alluded to, there's not one thing that we know either causes you to get colorectal cancer or prevents it. It's multifactorial. It's, eating a healthy diet and living a healthy lifestyle and being a healthy weight, all of these things. But we do think that a high fiber diet may be protective. Just because you eat a lot of fiber doesn't mean you can skip your colonoscopy and you don't have to worry about anything. But there are studies that show that a high fiber diet may help to protect.
And obviously it helps with other diseases as well. Heart disease would be a good example of that.
Absolutely. And I see a lot of patients who have anorectal complaints. So, they're having rectal bleeding and things like that. And that's one of the things that, unfortunately, probably one of the reasons why we see an increased incidence in young people. There's some sort of, environmental exposures or multifactorial issues. But so many times a young person comes in complaining of some rectal bleeding and everybody just says it's their hemorrhoids and they never get checked. So nobody does a digital rectal exam or a colonoscopy or something like that. So being aware that having bleeding is not a normal thing. Fiber can help with bleeding, and it's oftentimes the first thing that I'll prescribe to patients who are having rectal bleeding. But if that bleeding doesn't stop, then you need to have further investigation.
Very good. I guess some people might be a little concerned that just because something is happening, that means immediately, they're going to have to get operated on or something. But it sounds to me that it starts as more of a conversation with their primary care physician, maybe one of you doctors, and then together you work with that patient at the timing that's appropriate to get them the care that they need.
Absolutely.
That's great. I know that, COVID's obviously been on our mind for a long time, and people have been working to limit their exposure. In response, a number of folks obviously have canceled preventative care appointments, including colonoscopies. And I'm wondering, Dr. Kim, if you might have a message for folks about what sort of dangers that entails.
Yeah, so COVID is definitely scary, and we don't want people to come into the hospital and die from that. So Siteman Cancer Center has done some fantastic jobs to kind of minimize the risk of that. There's temperature screening, there's health questionnaires, people are wearing masks, we are compliant with CDC guidelines, and we try to prevent it as much as possible. People are COVID tested before procedures that may aerosolize the virus. As far as delaying the diagnosis and delaying the care or the screening, it could really affect your life a lot. And so, like Dr. Silviera was talking about, the later the stage the cancer becomes, the more difficult it is to treat. So catching it early, even if it's a vague symptom, so that you can take out something that's precancerous as opposed to something that's spread to other organs, that's huge. And so we realize that it's a very scary time that we live in, but we highly recommend that people continue to be compliant with their screening studies and continue to get checkups.
Very good. Thank you for that. And we do have one more viewer question here, and Tina asks, how do we all know if we're getting the best care or treatment? And she doesn't say for what, but I assume it might be for colorectal cancer or maybe symptoms related to that. Dr. Silviera, Dr. Silviera, can you offer some insight there?
Sure. So, I mean, I think that, you know, you need to make sure that you're seeing a group of physicians that you trust, hopefully that are board certified in, you know, whatever cancer. If we're talking about colorectal cancer, if you're seeing a surgeon, hopefully you're seeing a board certified colon and rectal surgeon. That's something you can check online. And then, you know, you need to just basically trust your doctor and see, do you have a good connection with them? You can ask questions. You can ask for a second opinion. I think these are all very reasonable things. You just need to feel comfortable with your treating team. So if you see a surgeon or a radiation oncologist and you just don't connect with them, you ask some questions that they don't want to answer, you maybe bring up, I'd like to get a second opinion, and they don't want anything to do with that, those are probably red flags that, you know, look elsewhere. But yeah, it's tricky. You know, just like if I take my car into the body shop, I don't know who's a good mechanic or not. You know, the public, they struggle to find good surgeons. I can say, you know, I'm proud to work here at Siteman Cancer Center. There's a lot of world-class physicians, and I would trust any of these physicians that I'm working with to take care of myself or my family members. So I think that you'd be in good hands at Siteman.
That's certainly a comforting thought to hear, and especially I think we want to send a message out to folks who may have delayed their preventative care appointments that now is the time. Obviously, more of us are being vaccinated. All of us are vaccinated, which is why we're not wearing masks right now. But if you have delayed that, now is the time to come in and have that done. Would you agree?
Absolutely.
Very good. Well, we've run out of viewer questions as well as time, so I want to thank you, Dr. Kim and Dr. Silviera, for joining us today and sharing this important news. And to our folks out there, we want to remind you to keep watching Siteman's Facebook page for future Facebook Live events. And remember, if you've missed an appointment due to the pandemic or any other reason, now is the time to make that appointment. And you can do that by visiting Siteman's website at siteman.wustl.edu or by calling toll-free 1-800-600-3606. And thanks again, doctors, for joining us today. And thank you to our viewers. And we hope to see you soon. Bye-bye.